Hello, how are you? Welcome back. So, last week we had a clinical psychologist talk to us, answer our questions. And you know what? I want to say a big thank you, my heartfelt thank you to all of you. That was my first live streaming, which I'm sure you realize with half of the time, with me looking down half of the time. But it went well. It was informative. The feedbacks I've been getting have been positive. If you have anything you'd like to contribute, please do so. You can do it in the channel or you can send me a WhatsApp message. I'm willing to listen to, whatever it is, whether it's positive, whether it's negative feedback, everything helps. Before I go on, have you subscribed? If you haven't here, I always forget to say that. Please subscribe to my channel. Subscribe, press the notification button so that you know when something else comes up. And if you like, yes, put the like button there. So today, I'm not really going to do anything. What happened was last week, there were 3 questions that we did not get to because of the time. 1 hour went so fast, So Maud has been very accommodating. I sent her the questions and she has replied all of them by voice message. And I am going to play those messages back. There are 3 questions and I'll play them one after the other. For those who have asked that question and for the rest of us who want to know the answer to those questions, here we are. So that's all I'm going to do this week, and I'll see you next week. Subscribe. Do not forget, subscribe, press the button. Welcome to Coffee with Timmy. Bye for now.
I'll be responding to the question, what are the signs that someone is mentally unstable? First, I would like to shy away from referring to a person as mentally unstable. By using the word mentally unstable, it might imply that a psychological or a psychiatric evaluation has been done and thus a formal diagnosis has been determined for that particular individual. As a layperson, I would rather refer to a person as having signs or challenges with mental wellness. So rather we can say that the person is presenting with warning signs or potential signs indicating a potential for mental illness. Right. So basically, we're saying that there are 3 areas that can indicate that a person is or can be suffering from or having challenges with mental wellness. The first area is the cognitive, which is they can have an effect on their thinking. The second area is behavioral challenges. The third level is emotional well-being. Right. So basically, what do we observe or how can we see if a person is experiencing or is actually being affected? If there's changes in a person's sleep patterns, maybe they are oversleeping, or they are undersleeping, which is called insomnia. Right. So if there is changes in that area, then a person can start realizing that there might be a problem. There can be mood changes, fluctuation in moods, moving from being happy to sadness. So any constant changes in mood different from their ordinary self also gives us warning signs. A person can become withdrawn, basically meaning that they might end up avoiding to go and socialize. They refuse to, we invite them to come to church or to go out for a cup of tea. They no longer come to certain social activities that they usually attend. So those type of things, they prefer spending more time alone in their own bedroom, and even with the family, they no longer want to do the same activities like watching TV or playing games with them. They prefer being alone in their own room. They lock themselves in their own rooms. That can also be an indicator. They're functioning at home, at work, at church. It's no longer the same. The work is sloppy, or they can also be extremely meticulous. So it's not only the sloppiness of work, but also it's the increase in meticulousness in delivery of certain activities to their usual self, right? They become overly sensitive or irritable, annoyed. We're always shouting at kids, more exaggeratingly than before. We are so irritable that when they do small things, we just cannot take it. We start throwing things around. So our behavior is more exaggerated than the usual. Loss of initiative or desire to participate in activities is also quite there. Feeling disconnected. You no longer feel enjoying activities that you usually enjoy like before. So you don't want to do things that you usually enjoy. Watching the usual TV programs that you used to watch. If you enjoy knitting, you've lost interest in knitting or those type of activities that are usual, right? So basically, unusual behaviors. That's why I say that just looking at patterns that have changed in the way the person usually is a good indicator that they might be starting to having a problem. And the minute it starts affecting relationships with other people, the minute it starts affecting their work environment, their performance at work, their interactions with family members. So you will also start seeing certain discord in relationships. Maybe there's more fighting, there's more shouting that is taking place. Then it's time for us to start advising or encouraging the person to seek further intervention, either through their pastor, social worker, psychologist, or a doctor or a nursing officer. And other important signs I think that are quite interesting is also in relationship, we'll also notice that people will have either increased or decreased sex drive, which will affect couples a lot. We have people overeating and people who are binge eating, so they will have unhealthy eating habits. Social withdrawal or overactive social life. People end up getting involved in very dangerous or unhealthy, and risky behaviors. That looks like they're quite deliberate. Finding a woman who doesn't necessarily go out now wearing inappropriately, going out drinking, bringing different sexual partners, be it male or female. So this will be quite a change in their usual patterns of socialization. The use of drugs and alcohol. So basically using recreational drugs or using drugs or medication in order to either avoid or to self-medicate for other purposes, and meaning that the medication is not intended for. So basically starting to be dependent on substances in order to be able to try and cope with whatever situations that they are facing. So these are some of the aspects. So we need to be aware also of ourselves and also of our friends and family members. We need to be observant of any changes that are taking place that are not similar to the usual pattern of the person themselves. I hope this answers the questions. What interventions can be taken to change the stigma associated with mental health? There are a number of approaches or strategies that can be undertaken. One of the core ones that have been used, it's largely mental health promotion as well as prevention campaigns. And these can be undertaken within companies. Our employers and organization can initiate health days where mental health is promotion and prevention is done within the specific companies and organization. Health facilities, clinics, hospitals, any health provider can also provide mental health promotion as well as prevention interventions. This can also be done via non-government organization, NGOs, can be designed to be able to specifically deal with mental health interventions through promotion and prevention campaigns. Right. Other interventions that we can use is basically using methods such as contact-based interventions, such as support groups. And these support groups are people with similar mental health conditions that comes together to support each other, to learn more, to re-educate, and to support one another. There's also peer services that can be established, which can be incorporated within the health provisioning sector, where people with similar mental health challenges provide peer services to those who are newly diagnosed, to provide support, to enable them to be compliant to medication, as well as to give them support and strategies on how to best deal and manage their received or diagnosed mental diagnosis. All right. So basically, these are the core ways that can be done. Obviously, there are three levels where these elements can happen. We have institutional stigma, where basically through our own advocacies and ways we can influence government policies in changing mental health policies within organizations and institutions. And then there's also public stigma, where it's the general society's perception of what mental health is, and because of the perceptions that they have, the manner in which they will relate and treat the person with a particular mental disorder. At the core of it all, the most important that needs to be challenged is self-stigma. Most people have challenges dealing with their mental health condition, largely due to the perception they initially held prior to them having been diagnosed with the disorder. So once diagnosed, they now look at themselves with the same eyes that they were looking at others with the mental condition. Now, the perceptions they now held towards others, now they judge themselves with the very same eye. So that will then develop into negative attitudes, because they also have to now re-evaluate their perceived stigma that they had towards that mental disorder, now that it is them in the same position. So working on yourself is the best transformative mental health that you can ever do for yourself, because it means first you have to deal with the perception that you initially had towards a particular disease or disorder. So you need to re-educate your mind to develop and to define a new perception or reality of what the disease should mean for yourself. So that's making a cognitive shift and making changes on unhealthy formed perception. Once you've done that, it means that you now have to reframe your perception, redefine what that mental illness or what that particular disease or disorder mean to you. That's empowering yourself with knowledge and insight. Once you have empowered yourself, you gain strength to be able to become an advocacy or an advocate for the mental health itself, because the best teacher is the one that has gone through the training itself and have gained experience by walking the journey itself. So you're going to become the first educator about mental health as you are walking the journey, and you are talking about your lived experiences of the condition yourself. Self-empowerment is the best change intervention that you can do for yourself in terms of dealing with the stigma towards mental health. I'll be dealing with the question of how do we balance the reality of anxiety to not be perceived as lack of faith. By virtue of believing in something does not imply that you automatically acquire the highest level or the strongest level of faith. Faith is acquired through a process of trials, errors, as well as steadfasting and developing your truth. Every Christian is working on their own salvation. Our journeys are unique to ourselves. Our journeys are different based on the level of spiritual growth we are at. Thus, faith is a development process, and it is done so in order to solidify your own belief in the God that you have just found or have realized truly exists for yourself. The very fact that we all get constantly tested in some aspects of our life implies that we are all experiencing some level of anxiety in this testing phase. So the process of overcoming the test implies that you're working on your faith, you are strengthening your truth, which will thus reduce your level of fear. So if someone is experiencing some level of fear and experiencing some level of anxiety, it is in line with the truth they hold in their process of spiritual growth on the particular situation at hand. Thus, if you have mastered a particular situation, it does not imply that someone else will master it in the same way that you have. As human beings, we need to be considerate and understand that the people resolution of their own process will not necessarily be similar to the journey that you have undertaken, and accept that they will walk their journeys and they will overcome their challenges at a time when it is necessary for them to get their truth for themselves. It will thus be resolved, and their faith will then increase, and they would have steadfast in their walk in the Lord. So beware of being judgmental, that you are not looking at yourself in the eyes of another person. Allow them to walk their journeys and build their own faith according to their own process.